What's going on, fam, and welcome back. Today's video is about how to go back to therapy after you have been hurt by or otherwise dissatisfied with your previous mental health provider. This is actually a response video to a question that I am getting ready to read anonymously. A couple of days ago, I started therapy again. At first, the therapist was quiet before he asked me what's been going on. I started to answer, and midway through, he interrupted me to ask questions like my mother's name and whether I was self-employed, suicidal, or homicidal, blah, blah, blah. Then he proceeded to say, well, it doesn't seem like you suffer from depression. I'm so upset and feel so small. It completely made me not want to try this again. I already struggle with people pretending to listen for 15 minutes and then tell me I'm not depressed based on what I said. Can you do a quick video on how to get back into therapy? Because I don't want to. So first off, let me just say I'm so sad that that happened to you, because I understand how devastating it can feel to finally think that you're going to get some help and it turns out to be a dud. I can also say that I understand how that feels because it happened to me the first time that I pursued therapy as a patient, not as a therapist. My first therapist kept forgetting who I was. She forgot my name from week to week. The straw that broke for me that said I'm not going back there was that she mixed me up with a patient who was court ordered to attend therapy. So I was like, you don't even know who I am, lady. I gotta go. It was definitely like, I'm not okay with this situation. The other reason I think it's such a big deal for particularly Black people or people of color, in our community, mental health is still so stigmatized. And I come across this quite a bit with patients, with people that I just know, family members. It's still so stigmatized. So people will kind of wait until they need it, you know, or I mean, really, really, like you're just drowning in whatever you're going through. That's kind of when people will seek support. Otherwise, they'll try to kind of go along to get along until there's no, other possible way. And so by the time you go to therapy, by the time you pursue a therapist, you're already just so kind of discouraged with life. And then if that person is not the right fit for you, it can just feel like, what do I have left? What else can I do? So it's important to remember, one, that therapists are providers. They are people. They are fallible. They have strengths and weaknesses like everybody else. Some therapists tend to be more gentle. Other therapists are very blunt and straight to the point. There are different approaches to therapy. It's very important to know that even though you're going to talk to them about very personal things, very, emotional things that you're not really used to addressing, it's the same as going to see in many ways. It's the same as going to see a medical doctor. It's the same as going to see your dentist. It's the same as going to the post office and expecting the postmaster to do their job. It's the same as going to school and expecting the teacher to do their job. So as far as the fact that it's a service, it's a very personal service and a relationship has to be developed. So I don't want to minimize the impact of it, but you have to remember that this is a human being that is essentially doing a job. And in a way, I would hope that that would be somewhat freeing, because then you don't have to worry about hurting their feelings, just like you wouldn't if you go to a doctor and you don't like how the doctor treats you. You don't go back to that doctor. You find somebody else. You are the one who makes the decisions. Your therapist is there to facilitate your relationship with yourself in your life. So I wanted to just talk real quick about some do's and don'ts when it comes to engaging a therapist. And then I'm going to talk a little bit about how to kind of heal as you transition from one therapist to another. One, you want to ask questions. You get to interview your therapist. You get to ask them, hey, how long have you been doing this? What's your approach? Who do you typically work with? What populations? Ask the questions, and they should be able to give you a straight answer. And if you're not comfortable with the answers that they give you, then you get to decide. Maybe I want to try them out. Maybe I don't. Number 2, let the therapist know what's been going on with your previous therapy experience. I've had quite a few patients come to me letting me know that they're coming out of a negative therapy experience, and it makes me more aware of my approach with them. And I tend to be very upfront with, especially with those clients. I try to be more upfront with everybody anyway, but I'm more consciously and intentionally, okay, this is what I plan to do. This is how I plan to move. These are your rights. These are the expectations of me as the therapist. These are the expectations of you as the patient. And if at any time you feel uncomfortable, let me know. And I also let them know there's a difference between feeling uncomfortable because of the work that you're doing, because anytime that you enter into a therapeutic alliance, chances are, yeah, you're going to be stretched emotionally and mentally because you're unlearning behaviors, you're unlearning certain mindsets, you're unlearning things that you've been comfortable in before. So there's a difference between being uncomfortable with the process and being uncomfortable because you don't believe that you are being heard and listened to and respected. Number 3, don't be afraid to let the therapist know that you don't like their approach. If somebody's being too pushy, if somebody is not straightforward enough with you. Some people like homework. Some people want somebody to just listen. Some people like somebody who's more blunt. Other people like people who kind of, ease into the conversation a little bit more. Be upfront. I had a patient tell me that I made therapy feel like school. She didn't like that I kept trying to teach her about I don't know, I think she had anxiety or something. I was trying to teach her about, what that is and trying to give her examples. And she was like, well, this feels like school. I had to adapt. I can shift and I can alter some things, but then there comes a time when it's like, I just got to do my job. Which leads to my final do, which is simply take time. Take time to commit and to reserve judgment. So I've had plenty of patients say, I just kind of want to see how it goes in the first few sessions. And I totally welcome that. I just want to see how it goes. And if I still like it, we'll keep going. And I'm like, that's cool. That works for me. Because the bottom line is, I can't force you to stay if you don't want to stay. And I don't want you to stay with me if you're unhappy or you think that you're not getting what you need out of your process. So feel free to take time to commit, reserve judgment. Make sure you make that clear to whoever you decide to go with. I'm gonna take some time and make sure it makes sense for me. And if they have a problem, then that's really confirmation that this may not be the person for you. Now we're on to the don'ts. Number 1, do not stay anywhere that you don't feel as if you are being heard, listened to, respected, seen. I think I said that before. I'm probably going to say it again. Don't stay in spaces where you don't believe that you can occupy as yourself, including a therapist's office. Don't expect every therapist to be the same. Every therapist is not going to vibe with you, and I'm going to be honest, as a therapist, every client doesn't vibe with me. I've had some patients, and I alternate between clients and patients depending on the setting that you're in is whatever. Anyway, but I've had some patients when I'm like, oh, I wish. In any job, you're going to have some aspects that you're going to be like, bruh, why? Had some patients where I'm just like, I wish they would just decide that I'm not their therapist anymore because I can't. But I do. I can't, but I do. Because I love what I do. And I'm still going to be invested in my patients whether I like them or not. But every therapist is not going to be the same because at the end of the day, every therapist is still a human being. They're still a person. Aspects of their personality are still going to come through. We do have a code of ethics. So if a therapist does particularly feel triggered by a patient or has, very strong feelings about a patient or their circumstances, we are given leave to refer them elsewhere. But most therapists are going to try to stick it out. They're going to try to work with you. Don't try to force a therapeutic alliance. Don't try to align yourself with someone who you don't believe is going to be able to help you. Give them time, give them a chance, but if you're not feeling it, you're not, something is off to you, something doesn't feel right to you. I've had people say that they've had therapists that made them feel like they were being judged. And it might be very subtle, but especially and I'm going to speak as a person of color now, we know what microaggressions feel like. We know what it feels like for somebody to treat you as other or not take you seriously just because of what you look like or where you came from, what they believe your background is. This is something that tends to be very sensitive if you're entering a space where people don't look like you, people don't come from where you've come from. You don't want to have to explain yourself. I'll never forget when George Floyd happened, and I was so overwhelmed because it was the pandemic. On top of it, it happened during the pandemic, obviously, and it was George Floyd, and I think the Breonna Taylor information had just come out. All of that, it was very overwhelming. I made an appointment with my therapist, and she got on the screen, and she was like, "What's up?" And I was just like, "Black Lives Matter." And I laughed and she laughed, and it wasn't a laugh of we think it's funny, but it was, I get it. I didn't have to say anything else about it. I know you know where I'm coming from with that, and that felt good. So don't try to force things like that. If that's not how you feel, some people don't need that, and that's okay too. But if that's not how if you don't feel like this is somebody that you can connect with, this is somebody that's gonna, hear you and hear your voice, or you're gonna constantly have to, talk over yourself to explain your position, and that's not a function of your whatever you're there for, because that can be a function of anxiety, but you don't want to have to add to it. Don't hide your feelings. Don't feel like you have to tell the therapist what they want to hear. I have so many patients that will qualify their feelings with me. They'll be like, "Oh, well, this sounds so mean," or "I know it's not right, and I'm so sorry." And I usually have to shut that down. You are not here to apologize for your feelings. You are not here to, I'm like, you're not a monster, I'm not turning you, but it's that thought that you're going to be judged. And if you're judged by your therapist, then what else do I have? Where else can I go? A good therapist won't make you feel like that. That's the do's and the don'ts. Now I want to talk a little bit about healing from a negative therapeutic experience, or a negative therapy experience, because it wasn't therapeutic if it was negative. Number one, like in most things, you got to give yourself time to heal. Give yourself time to recover, but don't be idle. It's really important that you don't allow yourself to get pulled into a spiral of discouragement. Make sure you're letting yourself know, reminding yourself that this is one experience, this is one person. It really sucked, feel your feelings. It really sucked, but this is one out of so many, okay? Use the time that you would have dedicated to therapy to take care of yourself in some way, intentionally, with intention. Most people commit to an hour of therapy or 45 minutes every week. Until you find a therapist to fill that role, what can you do for those 45 minutes a week? Do something that is intentionally healing and relaxing for you. Working out, meditating or praying, napping, reading a book, listening to uplifting music. All of those things tend to fill people up. They tend to make you feel good. They tend to calm you. They tend to relax you without detrimental effects. If you do any of those things for at least 45 minutes a week, it will at least help sustain you, even if it doesn't totally pull you out of whatever you're dealing with. If you're a parent and you're dealing with a child that has any type of behavioral or emotional issues, intentionally use that time during the week, again, to teach them how to relax. So do 45 minutes of yoga or running around or reading a book together, cooking together, right? Be intentional. The time that you would take to take your child to therapy until you find somebody that you like, let that be intentional time to work on healing and taking care of yourself. You definitely want to avoid any self-destructive tendencies. Alcohol, substance abuse, listening to music that is not uplifting, sad music, angry music. You really don't want to listen to that on end, okay? Everybody likes their songs. I used to love me some Keisha Cole. You like what you like, but try to be intentional about staying away from things that feed into the negative feelings and thought process. TV as well. If you're gonna watch TV, stick with uplifting television. Try to stay away from the dramas and the soaps and the, constant action and violence and that type of thing. Studies have shown that listening and watching those types of things does feed into a mood that's already depressed. It'll kind of keep you in that spiral. So if you're gonna watch TV, watch your documentaries, not your murder crimes, right? But watch like the little dolphin shows or the turtles, the nature documentaries. If you listen to gospel music, but there's just also, music that promotes being happy and feeling good and being thankful and being grateful, so try to focus more on things like that. Try to incorporate that into your daily activity. Finally, and this is something that I often encourage my patients to do, often ask them, well, when was your happiest time in childhood? And, many of them can tell me about being 7 years old, 8 years old, and this is what was going on. And, and I always ask them, well, what were your interests? What were your hobbies? What were things you like to do? Because many of them can't think of things that they like to do now, which again, often tends to, feed into those negative, anxious, and depressed feelings. And so I'll say, well, what did you like to do back then? And they'll say, well, I like to color, or I like to dance, or I like to run, or I like to do this. And I'm like, well, why don't we try doing one of those things again? And often they find that when they try doing those things again, they feel good. It makes them feel good. So, try to incorporate an interest that you have, a hobby that you have. If you can't think of anything that you currently enjoy doing, think about the things that made you feel good when you were younger. Go as far back as you can remember and try to incorporate that into your day or your week to take care of yourself. Of course, just the basic taking care of yourself things, making sure you're drinking a lot of water, making sure you are creating an opportunity to get 8 hours of sleep, staying away from stressful and toxic engagements and situations. Every conversation you don't have to respond to. If you have a low social meter, maybe hanging out in a party where there's a lot of craziness going on is not the best time, but maybe staying at home with one or two of your really good friends that are going to be supportive and uplifting. Maybe that's a good place for you to be. What feeds you, what takes away from you. Start doing some of that work before you find your next therapist. You'll kind of help keep yourself afloat until you find somebody who can really do what they need to do to help you. I hope that helped, and I hope you remember, one experience is one experience. You have a whole life to live, so many more experiences to have. And I understand the devastation of a negative therapy experience, but all that means is that that person let you know that they were not the one for you and that you're going to find somebody that's better. All right? So thanks so much, you guys. Take care, and I'll see you next time. Bye.